Hello, and welcome all to the Modern Nurse Podcast. I am your host, Brooke, a current practicing certified registered nurse and educator. I want to thank you all for tuning in today. I'm so happy you're all here. On this podcast, we discuss all things current or topics and evidence-based in nursing, as it is more conducive and fun, in my opinion, to discuss current topics and trends in nursing than read them from an article or a textbook. Therefore, let's begin. Today we're going to be discussing something very near and dear to my heart and significant in nursing, which is always important, right? And that is certification. We'll discuss requirements for certification, examples of different certifications that a nurse can achieve, how certification can impact the design and delivery of culturally responsive advanced nursing practice, how certification can improve meaningful communication in the healthcare workplace. This is always important. And how certification can support leadership for sustained change within an identified area of specialty practice. So certifications typically are within a specific specialty. I myself hold a certification, which we're going to talk about a little bit more here in a little while. But before we really get started talking about certification, I'd like to introduce myself and let you know a little bit more about me. I've been a registered nurse for 6 years now, and I've always found that medicine is just absolutely fascinating. There's so many different realms and pathways that you can take in medicine. You know, you could have a room full of 20 nurses, and every nurse can be doing something completely different. Hopefully all 20 of those nurses are certified in their own personal specialty area. I'm a big fan of certification, and we're going to chat about why in just a little while. I've personally been at the bedside. I spent about 5 years there, and have also been a nursing educator now for 3 years. I absolutely love my job by being able to grow and mold the future of nursing and empower nurses to further their education, including certification. Really is my passion, and I feel as though I found my home in nursing. So, to begin, as a clinical nurse prior to becoming an advanced practice, I obtained my CMSRN, which is a certification of medical surgical nursing. So my personal specialty, my background, is in medical surgical nursing. Yes, a lot of people may think that that is not a specialty, but if you take a telemetry nurse who is straight cardiac, and you put them in a medical surgical environment with 6 post-op surgical patients, all of different surgeries, different post-op orders, different surgeons to work with, different protocols and order sets, it may be feeling like a little bit of a fish out of water. Therefore, medical surgical is absolutely considered a specialty, amongst others, which we'll discuss here shortly. I felt as though the time being July 2020 when I became certified, with this being really the start of the pandemic and the uncertainty, I needed to be a resource for the nurses on my unit. I felt a calling to help not only my patients, but my nurses who are caring for these patients. Becoming certified truly made me feel empowered and made me feel capable of the care that I was providing to my patients in such a time of uncertainty. Again, as this was the start of the pandemic. Having my certification has helped me to communicate not only with my peers, however, with my patients. I was competent and confident, both, and qualified to care for them. Again, especially at this time in the medical field when everything seemed to change overnight, right? There was a time where when we walked into work, we weren't allowed to wear masks. And then I came back the next night, less than 12 hours later, to work. And if you were seen in the hallway without a mask, you were sent home. You couldn't work. So let's get down to certification, shall we? So certification, it's basically an earned title via examination demonstrating mastery in a specialty area that a nurse practices in. According to the American Journal of Critical Care, nursing licensure ensures a nurse meets the minimum requirements to practice nursing, whereas certification validates the mastery of specialty knowledge beyond the scope of an RN in the specialty that the nurse practices in. In terms of the types of specialty, there's multiple different types of specialties that have national published, certification exams. Some for example, being my certification, my CMSRN, my Certified Medical Surgical Registered Nurse certification. There's a CNE, which is a Certified Nurse Educator. That's next on my list. CCRN. Everybody wants to go into ICU and go into all of the high adrenaline specialty areas. So I call it upon you, if you're a critical care nurse and not already, to gain your certification, your CCRN. There's also Advanced Oncology Certified Nurse Practitioner. There's Advanced Nurse Practitioner Gerontology certifications. There's hundreds of them. These are just a handful and a few examples of different certifications that house or hold, or I'm sorry, specialties that house or hold these certification opportunities. So why become certified? What's the point, right? There's multiple reasons. According to the American Journal of Critical Care, again, it promotes professionalism by bolstering commitment and accountability for ongoing professional development and lifelong learning. It demonstrates professional and cultural competence, according to the Academy of Medical Surgical Nurses. It demonstrates commitment, confidence, and credibility to the care that you provide your patients. It validates your expert knowledge. You gain confidence in your professional life as well. Also, trends have shown nurses who have their certification in a specialty area results in improved patient care and safety. So, how do I get certified? What are the steps, Brooke? How do I get certified? According to the AMSN, or Academy of Medical Surgical Nurses, there's 3 eligibility criteria to sit and take an exam, of course with a passing score, then gains you the certification. Step one, you must hold an unencumbered and current license as a registered nurse in the United States, its territories, or Canada. Step number 2, or checkbox number 2, you must have practiced 2 full years in a medical surgical setting with your RN license. And step 3, or checkbox 3, you must have 2,000 hours of practice within a 3-year time frame in a, for example, a medical surgical setting. So if I'm part-time and I've worked the 2,000 hours, but it's taken me 5 or 6 years, you're not going to qualify. So, excuse me. These hours, however, they can be clinical, meaning bedside nursing. It could qualify as hours working as a manager on a med-surg unit or whatever specialty unit, or as an educator. So, certification. It can impact the design and delivery of culturally responsive care and advanced nursing practice. Certification demonstrates the commitment, confidence, and credibility of care that you're providing to your patients. Therefore, the design of the care that you provide to your patients is elevated compared to non-certified nurses. There's further thought and consideration of the design and delivery of culturally responsive care as well. Speaking personally, throughout my care that I've provided, there's been a lot more thought and effort into my cultural responsiveness. And it elevates my advanced nursing practice. For example, the care that I provide to my post-op patients has further thought put into the plan, as I'm able to more confidently plan medically and surgically, and also incorporate my cultural assessments throughout my care to benefit the patients. Certification can also improve meaningful communication in the healthcare workplace. Throughout certification, one may gain confidence and satisfaction in their professional standings, which can improve meaningful communication. Becoming certified can also earn respect from patients, colleagues, and employers. This in turn can improve meaningful communication. With respect comes meaningful communication. You're viewed out in the workplace as more confident and competent. Therefore, when collaborating with the interdisciplinary team, often this will foster more of a meaningful conversation and communication, especially members who are at the provider level, and not only that, however, the patients as well. Certification can also support leadership for sustained change within an identified area of specialty practice, for example, med-surg or critical care. Again, with certification comes respect from colleagues, patients, and employers, such as those in leadership. Education is power, and so is certification. With certification, often opinions and suggestions made by certified nurses are taken more into account due to the foundation of knowledge and demonstration via certification. For example, if a certified nurse is actively practicing at the bedside and notices a potential process change or quality improvement change, leadership is likely to listen. So basically, with all those factors in mind, certification is extremely important to practice currently and in the future. So I urge you and urge your peers and your coworkers to become certified to best optimize your nursing career, safety for your patients, cultural competence and cultural responsiveness, and also meaningful communication. We'll tune in next time for the next episode. Have a good one.